which has resulted in the lifting of the partial closure. Oman is once again free of closure and soon life will be back to normal. But I want to remind you all that although the partial lockdown has been lifted, it doesn't mean that we don't have to adhere to the precautionary measures. In fact, the measures placed by the Supreme Committee are stricter than before. From September 1st, vaccination is a condition to allow entry to all government units and private sector establishments, including malls, restaurants, and other collective activities. And entry to the Sultanate from all land, sea, and airports will be required travelers to present proof of vaccination with both doses of a vaccine approved in the Sultanate. Moreover, in terms of vaccination, the ministry has already completed its vaccination drive in South Sharqiya Governorate today. As you all would remember, the drive started yesterday of expats living in the Governorate on Sunday, August 22nd, and was scheduled to end today at 2 p.m. at Sur Sports Complex. In addition to that, school students aged 12 years and above have been administered the first dose of COVID-19 vaccine in Ad-Dahira Governorate as the vaccination drive comes to an end. The Directorate General of Health Services in Ad-Dahira Governorate also announced that students who did not receive the vaccine during the campaign must go to the previously announced immunization centers in the Governorate without the need to take a prior appointment. Elsewhere, India has given an emergency approval for world's first COVID-19 DNA jab. We'll be looking into the details after a quick commercial break. Welcome back to TTV. You're watching Fighting COVID. According to Al Jazeera, India has given an emergency approval for world's first COVID-19 DNA jab. Yes, you're hearing that right. India's drug regulator has granted emergency use approval for Zydus Cadilla's COVID-19 vaccine, the world's first DNA shot against the coronavirus in adults and children aged 12 years and above. The approval gives a boost to India's vaccination program, which aims to inoculate all eligible adults by December and will provide the first shot for those 18 as the country still struggles to contain the virus spread in some states, Al Jazeera reported. The vaccine ZyCoV-D uses a section of genetic material from the virus that gives instructions as either DNA or RNA to make the specific protein that the immune system recognizes and responds to. Unlike most COVID-19 vaccines, which need 2 doses or even a single dose, ZyCoV-D is administered in 3 doses. In addition to that, COVID-19 booster shots of the Pfizer and Moderna vaccines are set to become available for all US adults beginning next month, the country's top health officials have announced last week. We know that even highly effective vaccines become less effective over time, Dr. Vivek Murthy, the Surgeon General, said at a White House briefing. He added that it is now our clinical judgment that the time to lay out a plan for COVID-19 boosters is now. People 18 years and older who receive the Pfizer or Moderna vaccines will be eligible for a booster dose 8 months after their second dose, officials said. The booster plan would go into effect starting the week of September 20th. People who got the single dose of Johnson & Johnson vaccine would also likely need an additional shot to prolong its effectiveness against coronavirus infection and to reduce the severity of COVID-19 symptoms, health officials have said. However, they're still conducting research and not yet releasing plans for booster shots for people who receive that type of vaccine. Moving on, massive UK study of COVID-19 cases shows that people who are jabbed have good immunity at first, but quickly become more vulnerable to the fast spreading of Delta variant, writes Catherine Sanderson for Nature, one of the world's leading multidisciplinary science journal. According to her, the Pfizer-BioNTech and Oxford-AstraZeneca COVID-19 vaccines are effective against the highly infectious Delta variant of SARS-CoV-2, but their protection drops away over time, a study of infections in the United Kingdom has concluded. Researchers at the University of Oxford in the UK and the country's Office for National Statistics analyzed a vast data set comprising the results of 2,580,021 PCR tests to check for SARS-CoV-2 from 384,543 UK adults between December 1st and May 16, 2021, when the Alpha variant was dominant, and 811,624 test results from 358,983 people between May 17 and August 1st, 2021, when the Delta variant was more prevalent. The results published in a preprint on August 19 suggest that both vaccines are effective against Delta after 2 doses, but that the protection they offer wanes with time. The vaccine made by Pfizer in New York City and BioNTech in Mainz, Germany, was 92% effective at keeping people from developing a high viral load, a high concentration of the virus in their test samples 14 days after the second dose. But the vaccine's effectiveness fell to 90%, 85%, and 78% after 30, 60, and 90 days respectively. The vaccine developed by Oxford and the pharmaceutical company AstraZeneca in Cambridge, UK, was 69% effective against a high viral load 14 days after the second dose, falling to 61% by 90 days. The drop in effectiveness shouldn't be cause for alarm, says Sarah Walker, a medical statistician at the University of Oxford who led the study. For both these vaccines, 2 doses are still doing really well against Delta, she says. The study shows that vaccinated people who become infected with the Delta variant carry high peak levels of virus. When the Alpha variant was dominant in the United Kingdom, vaccinated people who became infected had much lower peak viral loads. Well, this was all from a Fighting COVID studio for you today, but stay tuned as we'll be coming next week with more developments in coronavirus from across the globe. Stay tuned and keep watching TTV.